Hi, Tim Reha here live, Digital Health Summit 2013 with David N, CEO of Great Call. How are you doing?
I'm great. Thanks very much.
So we're getting started off in the morning. The coffee's kicking in. The excitement's ramping up. Tell me about your background. I love to meet entrepreneurs.
Well, I'm CEO of Great Call, and I originally came from the telecom space, but also in consumer marketing. So Great Call is really about serving aging consumers with technology, one side of my background, but we go directly to the consumer as opposed to through the healthcare system. So that is one of the differences of us versus some of the other people you're probably meeting and speaking to at the conference today.
So go over what happened inside in the last panel and what were some of the key topics and, I guess, hot points.
I think we saw a wide range of interesting pieces of information from the e-patient speaker talking about the challenges that patients have. And it was interesting to see her perspective because it was coming from a fairly technical literate younger person who is downloading lots of apps, lots of free apps from different areas to try to help them manage their health. And they kind of had an app for everything. And I think one of the things that we deal with every day is, of course, with aging consumers, they're not going to download 10 apps to use for different things. Some of them might have iPhones, but a lot of them probably don't. And so what our job is to put technology in their hands that they can actually use that's going to help them in different ways.
Yeah, so really the panel was cool because it was from the consumer's perspective and all the different things that they go through. How are you guys changing the game and really helping your target market?
Well, what we've really focused on, all of our products are designed specifically for the aging consumer. So they're easy to use, they're easy to see, they're easy to hold, and they're easy to hear. And those are the key components of anything that an aging consumer is going to want to use. So, and then on top of that, what we've really focused on is working with them to figure out what are the different applications they will actually use on a device like this. So you take a jitterbug, you give it to your mom, and on that device, she has medication adherence programs, she has access to nurses and doctors, she has personal emergency response services, so if something happens, she can get help immediately.
So it's a device.
Yeah, we have both a flip phone version called the Jitterbug Plus, and we have an Android touchscreen version on a big touchscreen that is basically a cell phone and mHealth platform all in one. Well, I was just going to say, so it comes with a complete portfolio of services to help, the aging consumer manage their health better, stay connected with their family better, which helps with, loneliness and everything else, keeps them engaged with their health, and, helps them live independent lives longer.
And it's really about the user interface design and the user interaction model.
That's right. Just making sure there's larger fonts, larger numbers, that things are louder, and that it's easy to use. And on top of that, it's also about customer service, because another thing anyone who has an older parent knows is they get very frustrated with poor customer service. If something's going wrong with something, if they're using something and something goes wrong, they want to be able to talk to a live person right away. They don't want to deal with somebody, and they want it to be live US-based customer service, and that's something else that we really focus on to make sure we're delivering.
So David, as a CEO, you're also, doing business development deals or whatnot. What types of folks are you looking to connect up with here at the Digital Health Summit?
Well, we're always looking for partners that have either technologies that we can integrate into our platform. So whether it was, Posit Science a few years ago, who develops brain games for aging consumers to stay sharp, so we take their technology in, or whether it's healthcare providers or payers like United Healthcare, who's here looking for technologies to help their consumers. So those are the types of companies that we're looking for to work with.
To link to you and your website, how do people find you?
At greatcall.com is the best place to start to find us and learn more about our products.
All right. Well, thanks so much for being on Digital Health Live and for being part of the family here. It's really great to see the connections and to hear your story.
Thanks very much.